Hello everyone, today we're going to cover acute pharyngitis, just the way you need to know on USMLE Step 3, because best way to get high scores on USMLE Step 3 is as you're reading the material thinking what kind of question they can ask you. So today we're going to go ahead and cover all the possible questions they can ask you about acute pharyngitis. So first cause. It is caused by group A strep. Symptoms: sore throat, tonsillar exudate, cervical adenopathy, and no cough. At this point, I want you to memorize all the symptoms. Anytime you see a question of acute pharyngitis, go back to the question and check if all the symptoms are present. Diagnosis: initial test is rapid strep test, and most accurate test is culture. Testing is not important. On USMLE Step 3, they're going to give you the question about acute pharyngitis and ask you what to do next. So important thing is to know all the symptoms, go over all the symptoms, and see if question has all the symptoms. If all the symptoms are present, give the patient treatment, penicillin or amoxicillin. Make sure to check if patient is allergic to penicillin. If patient is allergic to penicillin, treatment is azithromycin or clindamycin. But if the patient has 2 or 3 symptoms, then go ahead and do the strep test. For 0 to 1 symptoms, just give the symptomatic treatment such as Tylenol. So again, if anytime you have a question, acute pharyngitis question, go back to the question, check if all the symptoms are present. If all the symptoms are present, go ahead, pick the treatment. If 2 or 3 symptoms are present, then do the strep test. If 0 or 1 symptoms are present, give the symptomatic treatment. In adult, if you did the strep test and it came out negative, it excludes the pharyngitis. No further testing or treatment is required. Complication: rheumatic fever and acute post-streptococcal glomerulonephritis. Another frequently asked question on USMLE Step 3 is antibiotic use during the Group A beta hemolytic streptococcus pharyngitis reduces the risk of rheumatic fever, but it does not reduce the risk of acute post-streptococcal glomerulonephritis. Now we've covered all the questions they can ask you on USMLE Step 3 about acute pharyngitis. If you know this slide, you should be able to answer all the questions.